Hi, I'm Rod Green and I teach anatomy at the Bendigo campus. This series of video segments will introduce you to the contents of the pelvis. The first segment will look at the muscles of the pelvis, the second one will look at the vessels of the pelvis, the third one will look at the formation of the nerve plexi in the pelvis, the fourth will look at the innervation patterns of the lower limb related to these plexi, and the last one will review the contents of the main openings from the pelvis to the lower limb. We can see on the skeleton here the spaces that we've talked about previously, so we know that this is the false pelvis and the true pelvis is down in here. And we've talked previously about the fact that this is continuous as part of the abdominopelvic cavity. The other thing we can notice now though is that the pelvis actually has the attachments on either side of the two lower limbs. So what we're particularly interested in is contents from within the pelvis that are going to make their way out to each of those lower limbs. On this torso model we can see that some of the pelvic viscera have been removed so that we can actually see into the true pelvic cavity, but there are a number that are still in situ. When you look at the cadaver specimens, you'll actually see specimens like this where we can actually see those viscera, but they're not examinable as part of the lower limb module. However, you can just get some impression of some of the vessels and nerves that lie in the walls of the pelvic cavity, and they will be some of the contents that we'll be looking at as part of this lower limb module.
The contents of the pelvis that we're going to look at next are the muscles. In particular, we're only interested in muscles that are contents of the pelvis, that is, some part of the muscle lies inside the pelvic cavity and it makes its way to act down on the lower limb. Initially we're looking at an anterior view of the pelvis, and one of these muscles will already be familiar to you. You've already dealt with psoas as part of the vertebral column. The second muscle we can see here is iliacus, and we can see that both of these muscles have their bellies in part lying within the pelvis, and they're both making their way down into the lower limb, so they meet our criteria as being muscles of interest. You'll note the psoas minor is also in this diagram, but as its name implies, it is relatively minor and it's not acting on the lower limb, so we're not interested in that one. The other two muscles that we're interested in, you can see on this next slide. So this is a sagittal section, mid-sagittal section of the pelvis, and we can see two muscles of interest here that again both have their muscle bellies within the pelvic cavity. The first is obturator internus, and the second, partly obscured here, but we can see part of the piriformis muscle here posteriorly. Both of these muscles are making their way out through posterior exits of the pelvis, and if we look at a posterior view we can see that these muscles continue out to attach. So there's the piriformis, and here's the obturator internus coming out to attach onto the femur. There are some other muscles on this view, but obviously they've all originated external to the pelvic cavity. What I want you to do, if we go back to the first of these slides, is to apply some anatomical principles just to get a basic idea of where these muscles lie and what their functions might be. So there are four bits of information that are of interest: the origin, the insertion, the joint that's crossed, and applying the principles about position and orientation of muscle to understand the action that those muscles will have. So if we apply that to psoas, we can see that it originates off the anterior and lateral aspects of the lumbar vertebrae, and that's sufficient detail to understand its action. And we can see its belly runs down here and the tendon inserts onto the lesser trochanter of the femur. In doing so, it crosses the hip joint at this point, and it's clearly lying anterior to the hip joint and has a relatively vertical orientation. That means it would produce an anterior movement, which would be flexion in the sagittal plane. I want you to think about the other three muscles we've looked at, that is iliacus that we can see on this diagram, and obturator internus and piriformis that we can see on the other diagrams, and come up with those same bits of information. And you should determine those bits of information before you continue this video. You can pause the video now. We'll now look at the remaining three muscles. The iliacus we can see originates from the anterior aspect of the iliac bone, hence its name, and also passes down anteriorly to the hip joint to attach onto the lesser trochanter of the femur. So this muscle will also be a flexor of the hip joint. And in fact, when these two muscles act together at the hip joint, sometimes they're referred to as iliopsoas, that is, considering the two muscles together. If we look at the next view, this really doesn't tell us a lot other than the origins of these two muscles. The origin of the obturator internus, perhaps not surprisingly by its name, is from the internal surface of the obturator membrane, which would be lying about here, and from the surrounding bone inside the pelvis. The piriformis, on the other hand, originates from the sacrum, and as we can see, this would be off the anterior aspect of the sacrum. To understand their orientation, position, and insertions, we need to look at the next diagram. So if we look at this one here, we can see that here's the piriformis. It's emerging through this opening, the greater sciatic foramen, and attaching onto the greater trochanter of the femur. Obturator internus has a similar attachment, emerging from a different opening, but again coming out and attaching, and it's often described as the trochanteric fossa, but similarly it's on this posterior aspect of the greater trochanter. If we look at the orientation of these two muscles, rather than being vertical, we can see that they're both horizontal or very near to horizontal, which means they're going to act in the horizontal plane. They're also clearly posterior to the hip joint, and so because they're lying posteriorly in a horizontal plane, they'll produce a rotation movement, and in this case it would be external rotation of the hip joint.